Our patient teaching video is for acute anxiety disorder. Our patient is a 72-year-old man, recently widowed, who has been diagnosed with acute anxiety disorder. In our video, we'll be going over the diagnosis, the pharmacological interventions, and the non-pharmacological interventions for acute anxiety disorder. The diagnosis of anxiety. So what is anxiety? Anxiety is the body's natural response to stress. It is normal to feel anxious at times and is a part of everyday life. Anxiety is a tense emotional state typically described as a feeling of worry, nervousness, or unease, typically about an upcoming event or something with an uncertain outcome. Anxiety is normal and okay at times. However, it can become a problem when anxiety persists and becomes a negative part of everyday life. So when anxiety does persist and it doesn't go away, it can become a problem, and your doctor may diagnose you with acute anxiety disorder. Acute anxiety can arise at any time in life, sometimes brought about by a situational crisis such as the passing of a loved one, firing from a job, or any stressful situation. People can also be born with anxiety, or others can be diagnosed later in life. Everyone is susceptible to anxiety at any point in life. It is one of the most common mental disorders in the world, and WHO reports that 1 in 13 people suffer from anxiety globally. The exact cause is unknown, although evidence shows that factors that contribute to acute anxiety disorder include biological factors, family background, and life experiences. Acute anxiety disorder is diagnosed when more days are spent worrying than not for at least 6 months. The worry is challenging to control and may shift from different topics of worry. The symptoms of anxiety and worry must interfere with daily living, and the diagnosis, on top of that, the diagnosis of anxiety, you must have 3 additional symptoms. Some of those symptoms that can occur include having a sense of impending danger, panic, or doom, increased heart rate, breathing rapidly, sweating and or trembling, having trouble sleeping, difficulty concentrating, restlessness, and feeling weak or tired. As you can see, anxiety can have more than just emotional and cognitive effects, but also physical effects. So the science behind anxiety. When a situation is perceived as dangerous or stressful, as some are when a person has acute anxiety disorder, 2 brain circuits are activated. One leads to the cerebral cortex, the part of the brain that is used for thinking and decision making, and the other leads to the amygdala, which is important for emotional processing and therefore plays a big role in anxiety. The amygdala works alongside other brain structures to store emotional memories, including frightening and stressful events. When someone with anxiety perceives many things as dangerous, the amygdala can become overly sensitive and therefore hyperactive, causing you to become anxious more frequently. The amygdala is responsible for sending the message to your autonomic nervous system to go into fight or flight mode, which is a part of the cause of anxiety. There are many other structures involved in your brain when initiating anxious thoughts or feelings, but the amygdala plays one of the more important roles as it initiates the body's stress response, which is responsible for many of the physical sensations felt during anxiety. When living with anxiety, it is important to recognize your own personal triggers. Note when you become anxious and why it makes you anxious. Identify major life stressors. Why do you feel anxious? Or do you feel anxious when you're stressed? It is good to stay aware of your stressors and recognize the feelings that arise when those stressors occur. Caffeine can also sometimes trigger or actually increase anxiety, especially at night. Caffeine can increase heart rate, nervousness, and insomnia. Treatment options. It is important to note anxiety is very treatable and can become easy to manage with treatment. Going over treatment options with your doctor is highly recommended. Pharmacological treatment is not often first line for anxiety. Non-pharmacological interventions are usually tried first and can be just as good as managing anxiety as medications.
Pharmacological interventions. Citalopram acts as an antidepressant by selectively reuptaking serotonin. Serotonin works as a neurotransmitter and chemical in the body and is linked to depression. It is also commonly used as an anti-anxiety medication. When taking this medication, you may experience common side effects such as sweating, diarrhea, nausea and vomiting, dizziness and headache, insomnia, fatigue, tremor, agitation, and sexual dysfunction. If you are using anything to treat psychiatric disorders such as an MAOI, you must discontinue them 14 days before receiving citalopram. This drug can have potentially harmful effects in older adults, so if you notice anything, contact your healthcare provider. We will be monitoring your sodium levels to make sure that they aren't dropping and watching for SIADH, syndrome of inappropriate antidiuretic hormone, which causes the body to hold too much water. Do not stop taking this drug automatically. It needs to be gradually reduced, and you need to be watching for symptoms of withdrawal. The maximum dose you can receive is 40 milligrams a day because it can cause some heart dysrhythmias, such as QT prolongation. You may take it with or without food, either in the morning or the latter part of the day. Lorazepam is typically used as an anti-anxiety medication but can also be used as a sedative and to help prevent seizures. Sedatives typically induce sleep. When taking this medication, you may experience common side effects such as weakness, dizziness, you may lose your balance and become unsteady, depression, hypersensitivity, and a serious side effect is delirium. Warning: this medication is severely addictive and should be taken with caution. For anxiety, lorazepam should be orally given 2 to 3 milligrams a day and should be split into 2 to 3 doses a day. Geriatric patients typically start off with 1 to 2 milligrams a day, so if you find that this dose is not effective, we can gradually increase the dose. It can have potentially harmful effects in older adults. Please contact a physician as soon as possible if you notice any serious side effects. It can increase cognitive impairment, falls, fractures, and sensitivity. Do not abruptly stop this medication as it should be gradually decreased. I will write all this information down for you on a piece of paper, and if you have any questions, don't hesitate to call.
Next, we're going to talk about the non-pharmacological interventions of acute anxiety disorder. Using an alternative therapy has many benefits, including help managing your stress, and it can help you concentrate better. They may have less side effects associated with them than medications, and they may increase your general sense of health and well-being. This diagram here shows the importance to focus on not only your mental health and everything that's going on in your head, but as well as the importance to take care of your body and physical health as well. This is something that non-pharmacological interventions can help do. The first non-pharmacological intervention I'm going to talk about is cognitive behavioral therapy, also known as CBT. It is a very common therapy used to help manage stress and anxiety. So what is it? It's a talking therapy to help change the way you feel, think, or act. It aims to find practical ways to help you deal with problems in a more positive way by breaking them down into smaller parts to handle. What do you have to do? CBT is used for both mental health and physical health conditions. You can talk to your healthcare provider and they may be able to refer you and recommend you to a therapist. Typically, in-person CBT is 5 to 20 sessions and the price may vary. You will go and talk, answer questions, and help work through unhelpful behaviors and thoughts with a therapist. Ultimately, it helps you have less bad thoughts going inside your head and more positive thoughts going on. Deep breathing exercises have many recent studies that show health benefits to help improve your overall health, as well as reduce anxiety and help improve your sleep. In the picture here, there's a few examples of what exactly it does to improve your health. Deep breathing exercises are affordable. You can do it anywhere and it can be very calm and relaxing. It provides a positive distraction and it can be used to interrupt negative thoughts and behaviors. One of the most common techniques include inhaling slowly and deeply through your nose, keeping your shoulders relaxed. Then you exhale slowly through your mouth. As you exhale, purse your lips slightly. Repeat this exercise for several minutes to help reduce anxiety. There are many other non-pharmacological interventions out there to help reduce anxiety. It may be necessary to try some to see what works best for you. Other interventions include exercise, meditation, yoga, group session therapy, acupuncture, essential oils, herbal medicines, diet therapy. A takeaway message from this includes focusing on yourself, self-care, reaching out for professional help, and having support systems, whether that is personal or within your community, to help reach whole health. Thanks for watching our video.